My job is to welcome everyone to this very important gathering. And it really gives me a great pleasure that this event is happening today. It is reminiscent of what happened in the year 2000 when Nigeria held a conference like this to discuss HIV, TB, and malaria. Subsequent meetings after that gave rise to what is now called the Global Fund, which the entire world is benefiting from. So it started in Abuja here, and I have a feeling that this meeting is also going to start something big. I want to specifically welcome our special guest of honor, the President of the Senate of the Federal Republic of Nigeria, distinguished Senator Ahmed Ibrahim Lawan. Despite the short notice we provided to distinguished Senator, he was able to make it, to accept to be the special guest of honor and to honor our invitation. We thank you very much, distinguished Senate President. I'm not surprised, because having worked with you, I know that you prioritize matters. You know matters of national importance. And you have identified with this as an important priority to commence your week. Thank you very much, distinguished Senator. You were one of the leaders who first made a voice when COVID-19 was pronounced in the world. You were worried that you called to hear the brief from the Honorable Minister of Health and the DG NCDC then, and also initiated your committees to go out to determine the level of preparedness in this country. We appreciate your sense of urgency in important national issues and also your dedication to accomplishing national objectives. I also welcome all members of the PSC, particularly my indefatigable chairman, who ever since I started working with him, he has redefined my working hours. I used to go home maybe 8 or 9 in the evening, but now I know that I cannot close before 12 midnight. My chairman has been very dedicated to the cause. I don't have to the cause of COVID-19. He has engaged the entire nation. He has maintained the highest level of consistency, and he has maintained discipline in terms of the meetings of the PSC. Mr. Chairman, thank you, and you are welcome to this occasion.
Before I read my remarks, let me be open with my commendation of the leadership of the National Assembly, starting from the President of the Senate to the Speaker of the House of Representatives, with the chairmen of the various committees that have 1.5 years on the management of COVID-19 and its attendant health and economic challenges. Mr. President of the Senate, let me say very clear and categorical that the National Assembly has been our most resourceful and effective partner in this fight. You've provided all the resources we asked for. You've released your men to attend invariably all functions of the Presidential Task Force before we transited to be in the Presidential Steering Committee. And I take this opportunity to truly thank the two chairmen of the committee, Senators Ibrahim and Otazi, and Chairman Dr. Sanunu and Dr. Michelia, who have worked tirelessly, engaging us and providing the effective oversight, without which the national response crafted by Nigeria would not have recorded the kind of success we've recorded. And to say, I'm delighted to welcome you all to the National COVID-19 Summit, aimed at bringing all stakeholders together to discuss the theme, pushing through the last mile to end the pandemic and build back better. This will create the opportunity to identify successes, gaps, and lessons learned so far in our national response to COVID-19 from March 2020 till date, in the bid to develop strategies to actualize the international commitments towards ending COVID-19 before the end of the year 2022. You will recall that Mr. President approved the setting up of the Presidential Task Force on COVID-19, PTF, to lead the national response in March 2020. This has led the execution of interventions geared towards achieving epidemic control of COVID-19 in Nigeria and improving our health system, infrastructure, and manpower to enable us conveniently confront any future outbreak, and also build our potentials for medical tourism. In December 2020, the President authorized the transition of the PTF to a Presidential Steering Committee on COVID-19, PSC. Nigeria's COVID-19 response has been driven by science, data, and experience till date. The national response has been driven by a multi-sectoral process which facilitated expansive and in-depth consideration of issues as well as speedy decision-making. The process enjoyed the overwhelming support of the partners from the private sector and the international community. Through these partners, Nigeria was able to put in place critical infrastructure nationwide, procure scarce medical equipment, test kits, and personal protective materials. Today, we are here to assess the level of impact of our national response and develop strategies as we push through the last mile to end the pandemic while we build back better. There is no gainsaying that the outbreak of COVID-19 pandemic in Nigeria, which was triggered when the index case was confirmed on the 27th of February 2020, precipitated significant disruptions to the healthcare system and socio-economic lives of Nigerians. Due to the evolving dynamics of COVID-19 pandemic, with progressive mutations of the virus to more transmissible and deadly variants, the international community has corroborated the insinuation that the pandemic will persist for a few more years. This understanding has impelled world leaders recently to come to a conclusion that if efforts are not renewed and aggressive measures are not taken, COVID-19 pandemic will continue to ravage humanity well long than earlier envisaged. Hence the need to adopt an ambitious but cautious agenda to end COVID-19 pandemic by the year 2022. Consequently, this summit is a follow-up towards Nigeria's commitment to the ambitious global agenda movement to end the COVID-19 pandemic by the year 2022 and building back better. Global efforts at ending COVID-19 pandemic are intrinsically linked to the call for nations of the world to take steps towards strengthening their health system and biosecurity, which will make for a better pandemic preparedness and ability to respond more robustly and swiftly to future pandemics. Your Excellencies, Royal Fathers, distinguished guests, ladies and gentlemen, we are now in the era of vaccines and non-pharmaceutical intervention measures. We need to encourage all eligible persons to get vaccinated and to keep observing the washing of hands, wearing of face masks, keep physical distance, and avoid crowded areas. Nigeria has invested in enough vaccines that can cover over 70% of our population before the end of 2022. These vaccines are safe, efficacious, hence it is better and safer to be vaccinated against the virus now. This summit promises to be very rewarding, and at the end, we are all expected to have carried out the following. 1, renew or review the country's COVID-19 response from February 2020 to November 2021 to identify successes, gaps, and lessons to be learned. 2, identify resources and develop strategies that would actualize the country's express international commitments towards ending COVID-19 by 31st of December 2022. 3, develop an accountability framework for COVID-19 response and health security in Nigeria. 4, synthesize the blueprint for Nigeria's pandemic recovery reconstruction, health security, and sustainability. And 5, articulated actionable recommendations to President Muhammadu Buhari on the governance structure, resources, and policies needed to end COVID-19 in Nigeria by 31st December 2022 and build back the health system and the economy to better respond to future health security threats. On this note, I look forward to a very, very fruitful deliberations. And I want to urge our partners, particularly the development partners, and members of the National Assembly that will be participating in the discussions, to be brutally frank with us as to where we are and what we need to do. Because COVID-19 is not likely to go away in the very near future. And in an attempt to put a sustainable framework that would ensure continuity in the administration of what we've been able to put in place now, there is need for openness and frankness. Where we've done well, applaud us. Where we have not been able to meet up to the expectations of our people, remind us of the task that lies ahead. Be critical as much as you can, but also encourage us in one way or the other. I will not end these remarks without acknowledging 2 gentlemen that worked with us on the Presidential Task Force. And if we have modestly achieved anything as a body, I will continuously acknowledge the efforts of Dr. Sani Aliu and Dr. Chike Ekezo for their remarkable work. They have demonstrated that they are true Nigerians and truly, by extension, other members of the Presidential Task Force. I thank you for your kind attention and wish you a fruitful deliberation. Thank you and God bless.
Thank you very much, sir. Please, can that round of applause continue until he takes his seat? Thank you very much, ma'am. You're welcome.
Okay, thanks. Standing on the quite robustly established existing protocols and contribute to Nigeria's efforts to defeat COVID-19. I truly believe that together, as the summit theme notes, we can review, reposition, and push through the last mile to end the COVID-19 pandemic and build back better, resilient health systems. For our part, the U.S. will continue to support the government of Nigeria in its efforts to respond to the pandemic. The strength of our partnership is reflected in the more than $130 million we have contributed towards COVID response. The strength of our partnership shows in the hard work of over 60 U.S. mission employees from the U.S. Centers for Disease Control and Prevention, the U.S. Agency for International Development, and the Walter Reed Army Institute for Research, who all worked closely to provide expertise, technical assistance, and logistics. Finally, it is reflected in our donation of over 29 million doses of vaccine to Nigeria to date. But our work here is not yet done. The United States continues to work with Nigerian stakeholders to prevent, detect, and respond to COVID-19 and to ensure this response is both effective and coordinated. We stand by this commitment because we know that nowhere is safe until everywhere is safe.
I'm quite privileged today to use the theme of this summit to speak of something that touches my heart, something that brings deep emotion out of me from years of experience. Since charity begins at home, I will look at the topic of global health security in the context of repositioning Nigeria to build back on ending disease outbreaks. As the individual makes the nation, and the nations make the globe, so also global health security is built on the foundation of national health security. And national health security itself is laid on the foundation of individual and or personal health security. It is that aspect of ensuring personal and individual health security that I wish to focus on. We do remember, of course, that WHO sees health in a state of complete physical, mental, and social well-being, not just the absence of disease. Build Back Better predates President Biden. It was in the Sendai meeting in 2015 that the Prime Minister of Japan, Shinzo Abe, stated, and I quote, "Build Back Better sounds like a new concept, but this is common sense to the Japanese people, coming from our historical experiences in recovering from disaster and preparing for the future. And it has become an important part of the culture of Japan." So you can understand why I'm talking about culture today. It was in that same Sendai meeting that the Japanese delegation proposed BBB as a holistic concept which uses disaster as a trigger to create more resilient nations and societies than before through the implementation of well-balanced disaster risk reduction systems, including physical restoration of the infrastructure, revitalization of livelihood, and eco-economy. And then they said one last point, which I think I wanted to raise, the restoration of the local culture. That's the reason why I'm actually focusing on that. So when we discuss BBB in terms of disasters and pandemic, we often tend to forget that disasters and pandemics seriously affect our environment, and most especially our culture. No matter what plans we formulate to respond to pandemics and disasters, we will surely fail if we do not seriously address the issue of culture and environment. As I said earlier on, global health security is just as individuals make the nation and the nations make the world, so also global health security must be built on the foundation of our national health security. And our national health security must be laid on the foundation of the individual and personal health security. COVID-19 is not the enemy. Lassa fever is of minor league. Yellow fever is yellow-livered. Monkeypox is child's play. Cholera is a dehydrator. Our underdevelopment and backwardness rest on 4 pillars: They are the real enemies of our nation. And they are the one, lack of patriotism, the destroyer of our nation. 2, self-interest, the burial ground of our national interest. 3, corruption, the executor of our orderly development. And 4, shamelessness, the destruction of our national pride. Over the last 60 years, these diseases, all affecting our culture, have become the combined endemic demolisher of the foundation of the individual health security, which are shaking the foundation of our national health security and in turn determine our irrelevance as a nation in contributing meaningfully to global health security. Mr. President, sir, and distinguished people who are here, anytime I think of Nigeria, I have Nigeria on my mind. I speak with passion. I'm deeply emotional. There's fever in my body. Pain racks the entire body. And I have to hold on to something to steady my stand. I have to hold on to something to steady my stand. I have wept for this country on several occasions. I will try not to do so today, but it looks like I'm failing. You must be wondering why I owe, because I owe this country much more than I can ever pay back. I grew up in the UN. You are wondering whether that's the United Nations. No. I grew up in the UN, which is Utopia, Nigeria. For indeed, at that time, Nigeria was my utopia. It would be an insult to call my father polygamous. He was multigamous. The number of his wives that I know is more than all of the excellencies and honorables who are sitting out here today. I came as number 39 in the list of my father's children. We were being bred as hands for his farm. Then we had good governance. Just before the colonial masters left, the government of Obafemi Awolowo introduced free primary education in my region. It was not just only free, it was also compulsory, giving my father no choice of sending me to school or going to prison. He took the simpler way and sent me to school. From that singular act began my journey of indebtedness to my country. After the free education in my village close to Ilesha, now in Osun State, I took an entrance examination and got admitted on partial scholarship to the government college in Ughelli, now in Delta State. Nobody followed me to take the exam hall. Nobody followed me to the interview. From there, I moved on to ABU Zaria on full federal scholarship to read veterinary medicine. All my education was done in Nigeria. Going to Ughelli from Ilesha, a 2-day journey, was in the army's transport without anybody escorting me. I was just about 12 years old then. Our parents handed us over to the driver with money for our food. If there was any change, the driver would hand over the balance to our parents on his way back through Ilesha. So it was. I left Zaria at 12 noon after I finished and graduated on Wednesday, 30th of June, 1971. And started work as a research fellow at the University of Ibadan, which was the Rockefeller Foundation Center, at 8 a.m. on Monday, July 5. 5 days in between, because there was a weekend in the end. I am what I am today because Nigeria, my utopia country, provided an enabling environment for me to thrive and to excel. I give glory to God and thank the great citizens and parents of our nations who love this country more than they love themselves. But soon, an outbreak occurred. We later became endemic. It came as surreptitiously, slowly killing our nation. It was a disease that affected the 3 pillars of our nation, touching every stratum, damaging every fiber of our nation. The disease slew good governance, murdered societal sanctity, and eradicated individual integrity. The disease annihilated the good in our culture and elevated to prominence the ugly in that same culture. The disease came in 3 forms: greedy self-interest, blatant lack of patriotism, and unabashed shamelessness. Today, we lie to each other. The government lies to us, and we reciprocate with bigger lies. Telling the government it is doing well, when we know it is not. We clap our hands loudest with ovation for non-performing leader. We acclaim in pretended joyous ecstasy those who should not, even when we know they are not telling the truth. We pray that our King will live forever. And he says amen. Both of us dividing each other because we know we shall not die one day. I woke up every day to hear, I woke up recently, just today, to hear that Canada no longer recognizes my genuine vaccination card. And Britain has clamped a travel ban on me. A few days ago, I had to know there was Omicron in Nigeria from outside. The same Canada was telling me that Nigerians who traveled out with negative COVID laboratory results were Omicronized. Before my own CDC finally tells me that we had the variant, detected in samples collected from people recently traveled from South Africa, I asked myself, were they the people on the entourage of President Ramaphosa, or were they other people? They did not tell us that. We painfully call the reaction of the UK and Canada, we call it racism, inequality. But I say we are paying for condoning our errors of commission, and we are for overlooking our errors of omission. Mr. President and eminent leaders of our country, we must apply Build Back Better first to our old cherished culture. If we must reposition our country to end current and future diseases and pandemics, we must start with building back better those aspects of our culture that revered honor, that treasured integrity, that prized probity, that appreciated accountability, that valued transparency, that embraced honesty, that practiced fairness, that ensured equity, that dispensed justice fairly, and which cherished patriotism. Mr. President, the generation of Nigerians we have today is much smarter than my generation. Give them 1/10 of the enabling environment opportunity which good governance gave my generation, and Nigeria will be donating vaccine to poor Europe, as India is doing. Nigeria will be providing loans to China, and not the other way around. The first epidemic that we must address is the one affecting our culture and true Nigerianness. We must have a nation where national interest buries self-interest. Otherwise, this summit will become a mirage and a vapor. It will be burnt to ashes by the fire of evil that plagues us. Unless we build back better on our culture, the outcome of this summit will descend to the valley of the disregarded and the disremembered and become another expensive exercise in futility. Mr. President, eminent participant, I speak as I have spoken because I love this country, because I have no other country. I thank you all for this unique opportunity to speak in my mind. Thank you very much.
A standing ovation for Professor Tomori.
Distinguished Ahmed Lawan. Can we have a round of applause for him, please?
Somebody should tell him to pull it this way.
He's going to, from the other end. Because of the live streaming, we are going to use this mic, which I'll take to him.
Everything we do here, the Ministry of Health, the Federal Ministry of Health, is supposed to be here to garner all the resources that will come out of this. The PSC is simply an interventionist outfit. And as politicians and political leaders, we are supposed to be very serious and committed to the health of our people. Thank you very much. Very distinguished ladies and gentlemen, I'm very pleased to be here. It gives me great pleasure to address this distinguished audience on the COVID-19 summit with the theme, End the Pandemic and Build Back Better. The theme is apt in view of our concerted effort to respond to the pandemic, save lives, and build back our economy. In the light of this, I wish to salute the astuteness and exemplary leadership qualities that Mr. President, His Excellency President Muhammadu Buhari, GCFR, has exhibited in assembling this very strong technical and managerial team under the astute leadership of the Secretary to the Government of the Federation, Mr. Boss Mustafa, towards controlling the pandemic and ensuring effective mitigation of its impacts on the socio-economic lives of our people. At the expiration of the timeline for the implementation of the mandate of the Presidential Task Force, PTF, Mr. President inaugurated the Presidential Steering Committee to continue to coordinate the multi-sectoral national response and consolidate the gains of the PTF. I sincerely appreciate and commend the PSC for the great work it has done in effectively coordinating and mounting a formidable national response to this emergent global public health threat. Let me also pay tribute to our very patriotic and gallant health personnel who have sacrificed so much to fight against the pandemic in order to protect us. Nigeria, our dear nation, will remain indebted to you. The 9th National Assembly, under my humble leadership, has equally played a critical role in supporting the executive arm of government to respond frontally through the passage of the Quarantine Act 2020 in order to mitigate the effects of COVID-19 on our citizens and the economy. The Act provided and regulated the imposition of quarantine and made other provisions for preventing the introduction, spread, and transmission of dangerous infectious diseases in Nigeria. The National Assembly proactively reviewed the medium-term expenditure framework, MTEF, and the 2020 national budget in order to sufficiently fund the national response to the pandemic and to provide economic stimulus packages for Nigerians. In addition, after meticulous scrutiny, the Assembly gave approvals for various loans requested by the executive arm to fund the 2020 national budget. Members of the Senate gave up 50% of their monthly salaries to provide relief materials for Nigerians to cushion the effect of the pandemic, while some distinguished members of the Assembly procured and distributed various COVID-19 relief materials to their constituencies. And it's the same thing with members of the House of Representatives. Those who are personal contributions and sacrifices. Distinguished ladies and gentlemen, the oversight functions of the Assembly necessitated the proper scrutiny of how the aforementioned funds were expended and also monitor strict compliance with the resolutions concerning the fair and equitable distribution of palliatives to the vulnerable. The executive was engaged on the implementation of the Social Intervention Program, SIP, in response to the needs of the citizenry. To a large extent, the leadership of the National Assembly maintained a substantial level of transparency by making all its engagements and meetings on COVID-19 pandemic open to the public in order to provide information on major interventions undertaken by the National Assembly. Distinguished ladies and gentlemen, the emergence of the Omicron variant of the virus points to the fact that the pandemic is yet to be over. Hence, we should not rest on our oars in fighting the pandemic. However, our recent experience has also shown that outbreak of diseases affects not only the health sector, but also the socio-economic sector of the nation. To this end, there is need for a continuous multi-sectoral approach that integrates multiple work plan and collaboration to establish a sustainable biosecurity framework for Nigeria. As we are working towards ending the pandemic and building back a better Nigeria, an all-inclusive approach which focuses on addressing issues relating to the economy, health, housing, social security, infrastructure, etc. should be employed. Engagements with the critical stakeholders such as constituencies, civil society organizations, CSOs, faith-based organizations are critical to achieving this goal. Distinguished ladies and gentlemen, I urge you all to see this summit as a platform which affords us the opportunity to review our response, deliberate, and chart the way forward. I want to also assure you that the National Assembly will play its role in ensuring timely implementation of your recommendations. It is therefore very important to state here that in the 2022 appropriation, which is likely to be passed by the 14th or 16th of this month, whatever is necessary will be provided for Nigeria to continue to fight for the pandemic and beyond it. And I like that applause, but there is a condition, a caveat, that those who will be giving those funds, and that's why I asked for the ministers and the permanent secretary and the agencies, of course, under the Ministry of Health, need to provide the kind of prudence that is necessary. The economy, the efficiency in the deployment and application of those resources. And I will urge our committees who have been working very hard and very closely with the PSC and even before the PSC to ensure very strict and rigorous scrutiny and oversight on our funds in 2022 when we are able to provide them to the ministry and its agencies. And I want to take the opportunity to assure all Nigerians that members of the National Assembly and other political leaders of this country take the health of Nigerians very seriously and will continue to be always alive to our responsibility to ensure that our citizens are protected and are provided that kind of opportunity to take the vaccines. And coming to taking the vaccines, I believe that we need to do more to ensure that the vaccine hesitancy is minimized or eliminated if possible. Presently, of course, we know that just about 3% of Nigerians have been vaccinated, and we need to do for over 70% or at least 70% for us to be safe. So we still have a long way to go. I believe that we can do better when we are able to connect and link properly with our citizens who definitely need this kind of maybe talking to them, and through our royal fathers and faith-based organizations, maybe we get them to do better in terms of making themselves available for vaccinations. It is therefore my singular honor with this and privilege to declare this summit open, and I pray that we are able to come up with all the resolutions that the government, the federal government on both sides, the executive and the legislature, will be able to provide the resources and implement your recommendations for the betterment of the people of Nigeria. Thank you very much. God bless the Federal Republic of Nigeria.
So, yes. Can we come down? Can Senator Otazi join them? Here, this front row, please. Senator Otazi join them. Could you join them, sir? Could you join them, sir?